Hey, Innisfil, it is Tuesday, May the 5th. I was just on the health unit's website. I try to check it daily just to see how the cases are in Innisfil. And I was happy to see today that there were no new cases. We're standing now at 26 total. Thankfully, none of them hospitalized. So we're doing really well, but that doesn't mean that we can let our guard down. It means that what we are doing is working, and I appreciate everybody making the sacrifices to keep all of us safe. And we will keep following the medical officer of health and his advice and do what he asks us to do, and we'll get through this together. In the meantime, council is meeting regularly, albeit virtual. We're on a regular scheduled meeting, and thanks to the IT team at the town, it's been pretty seamless. We're even doing extra meetings, rather our regular council meetings, but we're also having some training sessions, workshops. So this week, Wednesday at 6 o'clock, we're having a workshop on our shores policy, which is a shoreline policy for the town. And it gives us the opportunity just to make sure that we all understand it. It's this job, you never stop learning. I can tell you after 25 years, there's not a day go by that I don't learn something new. That's one of the things I love about the job. So it's really important that we keep up with these workshops and training sessions so that we can make the best informed decisions for all of us going forward. The other thing I'd like to talk to you about today quickly is Canadian Mental Health Association is celebrating the 69th annual Mental Health Week. So their hashtag Get Real campaign is on for the week. And it's encouraging people to check in on how they really feel. So when someone says to you, how you doing? And you say, I'm fine. Are you really fine? Instead of just saying you're fine, why not have a real conversation about some of the stresses that you could be under during this time? Many of us are. 1 in 5 Canadians will experience a mental health issue or mental health illness each year. 1 in 5. And that is in a regular year. So you could imagine that in a year like this, there'll be added stress. And I would imagine that those numbers will increase significantly. Whether you're a frontline worker, you're going to have some really unprecedented stress on you. And then there's others that are struggling with the lack of social and physical distancing, especially some of our seniors. You know, you might be having some financial stresses. You could be worried about loved ones in a long-term care home. You've got your kids home 24/7 for the last 7 weeks without a play date. I mean, there's so many things right now that can really work on our mental health. And so we have to work extra hard at making sure we're taking care of it. You can get more resources at mentalhealthweek.ca. And please take a moment to check in with your loved ones, give them a call, do a video call. I've taught my 85-year-old parents how to do FaceTime, and if they can do it, anybody can do it. And I love to get to see them, and I know they like it too. So take advantage of those things when you can, and remember that we don't have to be apart. We can come together, even though it's just virtual. So thanks, Innisfil. Stay safe, and we will talk soon.